Hi, everybody. Our names are Gabriella, Rachel, Julia, and Caitlin, and today we are going to be giving a presentation on the role of an occupational therapist in the acute care setting, specifically treating a patient following a stroke.
Our learning objectives are to describe the role of occupational therapy in the acute care setting, identify common impairments after a CVA that may impact occupational performance, explain how OTs address these impairments to promote safety, independence, and participation, and check understanding with a multiple choice quiz.
What is occupational therapy? Occupational therapists and occupational therapy assistants support individuals in engaging in meaningful daily activities that promote independence and overall well-being. These meaningful activities or occupations are the everyday tasks that gives a person a sense of purpose, enjoyment, and independence, such as taking a shower, driving, or going out to dinner with friends. In the acute care setting, a client may benefit from an OT eval or treat if they struggle to complete daily self-care tasks, such as bathing, dressing, grooming, or toileting, or are showing difficulties with upper body functioning, including balance, vision, sensation, cognition, perception, and safety awareness. An example, a client status post's rotator cuff repair is having difficulty completing self-care tasks such as dressing and grooming due to pain and limited shoulder range of motion. The OTP would help the client learn adaptive strategies with adaptive devices such as a sock aid, complete light stretching and gentle range of motion to improve task performance, and pain management with mindfulness and deep breathing techniques to promote independence and safety during self-care tasks.
After a CVA, a person can experience body neglect, where a person fails to respond to or recognize stimuli on one side of their body opposite of the lesion. For example, only shaving half of their face. Or they can experience spatial neglect, where a client fails to notice or attend to objects or people on their affected side. For example, only eating food on the right side of the plate. Neglect can reduce safety and independence in ADLs and IADLs. Clients may care for only one side of the body, bump into walls or furniture on the neglected side, and these limitations can impact self-care, mobility, meal prep, and community participation, leading to fall risk and lack of engagement in activities. As OTs, we can do awareness training with video feedback, provide bilateral activities, provide hand-over-hand assistance, and also provide environmental modifications.
Subluxation is the malalignment caused by the instability of the glenohumeral joint. It occurs in clients with flaccid or hypotonic upper extremities due to weak shoulder muscles and poor scapular alignment. It can be inferior, which is most common, anterior, or superior. How does it limit engagement? Pain, weakness, and limited range of motion can make it difficult to use their affected arm safely during daily activities such as dressing, grooming, and reaching tasks. As OTs, we can apply taping techniques such as the tri-pull method for alignment and support, as you can see on the right-hand side. We can use e-stim, and we can recommend and educate clients on slings and positioning devices to maintain joint stability, skin integrity, and comfort, which is located on the right and left.
Following a stroke, an individual may experience ideational apraxia. Ideational apraxia presents as a lack of knowledge regarding how to perform a specific task or how to use an object to perform a task. It's important to know that the person's sensory and motor functions are still intact, but they are still unaware of how to perform the task. This is caused by damage to the anterior or middle cerebral arteries, affecting the frontal or parietal lobe. It limits all aspects of engagement, as an individual may be unaware of how to perform their meaningful everyday tasks. For example, grooming tasks may be affected by the inability to use a toothbrush, razor, or hairbrush correctly. Occupational therapists can treat ideational apraxia through the use of a variety of strategies. For example, administering hand over hand to help guide a patient in performing an activity, helping a patient plan different movements out, providing step-by-step instructions either verbally or with visual aids, exploring different tactile stimuli of different objects to understand their differences, And then lastly, grading activities, making them easier for the patient to complete.
Now we are going to test our knowledge. Question number 1. Which of the following best describes the role of OT in acute care? Question number 2. Which of the following would an OT not do to treat neglect? Question number 3. Which of the following is true about subluxation? And question number 4. Which of the following occurs with ideational apraxia?
The answer to question 1 is B, supporting clients in engaging in meaningful daily activities by addressing immediate functional needs and preparing for discharge. The answer to question 2 is C, tell the client to pay attention to the other side of your body. Question 3's answer is C, it can occur in clients with flaccid or hypotonic upper extremities due to weak shoulder muscles and poor scapular alignment. And the answer to question 4 is D. Sensory and motor function is intact, yet patient is unaware of how to perform the task.
All right, so this concludes our presentation. Today, we explored the vital role of OTs in the acute care setting. We identified 3 common impairments following a stroke that impact occupational engagement, and then we discussed how OTs address these challenges to support safe and meaningful participation in activities. Thank you guys so much for listening and learning with us. I hope that you enjoyed it.
Below are the references we use to gather information and evidence for our presentation.